Good morning, Dr. Clarke. We're so happy to have you here to talk about atrial fibrillation. What is it? How common is it?
Good morning to you, ma'am, and thank you for having me. What is atrial fibrillation is actually the most common arrhythmia in the world, and it's the most common arrhythmia in the United States. An arrhythmia is when you have an abnormal electrical circuitry inside the heart. Specifically, atrial fibrillation is when the normal electrical system of the heart, which in the upstairs of the heart, beats 60 to 90 beats per minute on average at rest. Spontaneously, the upstairs of the heart starts to beat 300 to 500 beats per minute. And as I said, it's the most common arrhythmia in the United States, with over 10 million people in the United States being impacted by atrial fibrillation. And it is estimated that 1 in 4 adults over the age of 40 will be impacted by atrial fibrillation at some point in their lifetime.
Why is it important to diagnose and treat AFib early?
Well, atrial fibrillation is a progressive disease, which means that the longer it goes untreated, the more likely that some of the ill effects, which include some of the symptoms we may discuss, but also some significant conditions, will be more difficult to change or reverse. Untreated atrial fibrillation is associated with a 5 times increased risk for heart failure, a 2.4 times increased risk for stroke, a 2 times greater risk for sudden cardiac death, and atrial fibrillation, again, if left untreated, has been shown to have an impact on the progression of early dementia as well.
That is really scary stuff. So tell me, what are some of the early symptoms, and then how do you treat it?
Yes, so some of the symptoms, which can vary widely. Some people describe palpitations or feeling like their heart racing in their chest. Some people say that they feel shortness of breath or dizziness spontaneously, lightheadedness. Patients will say, I feel short of breath with exertion. Some people say spontaneously, I feel anxious. And some patients will say, man, I just feel like I'm slowing down. Like I feel like my age is catching up to me. When the reality is, it is the arrhythmia of atrial fibrillation that is driving that symptom. Now, the way it's treated typically is with medications. Sometimes those are called antiarrhythmics. Sometimes we use blood thinners. However, there's a procedure called catheter ablation. And what an ablation is, it is a minimally invasive procedure that is designed to try to isolate these abnormal electrical signals and impulses that trigger AFib in patients from the normal conduction of the heart, and allows the heart to maintain and restore a normal rhythm. It is safe and effective, oftentimes done as an outpatient procedure. As with most procedures, however, there is risk, and if a patient is interested, they should talk with their doctor about it.
Well, it sounds like there's some solid options in terms of surgery or medication. Where can people go for more information?
Yes, so Johnson & Johnson has a great and comprehensive patient resources to help educate patients about atrial fibrillation. There's also a website called Get Smart About AFib. Again, that's one word, getsmartaboutafib.com, in which patients can not only get more literature and resources about atrial fibrillation, but they can also discover if they are a candidate for catheter ablation and be affiliated with an electrophysiologist who can discuss this more for them.
Great information, Dr. Clarke. Thank you so much for helping us all get smart, and have a great day.
Thank you. You do the same.
The preceding portion of the Arizona Daily Mix was sponsored by Johnson & Johnson MedTech.